Good morning, and thank you for joining us today at our September T37 Professional Development events. I'm Nino. With us today is Pamela Shaw. Pamela is a Biosciences and Bioinformatics Librarian at Galter Health Sciences Library at Feinberg School of Medicine. She holds a master's degree in Library and Information Science and a master's in Computational Biology and Bioinformatics. She was employed for 20 years as a neuroanatomy and neuropathology technician before moving to the Galter Library. She provides consultation, instruction, and creates library guides on bioinformatics and biomedical literature resources, and serves as the NIH Public Access Policy Compliance Reporter for Northwestern University. Pamela's talk today will be on NIH Public Access Policy and what you need to know. So I will now pass it on to Pamela to get us started.
Thank you. Hi, everybody. So I am Pamela Shaw, and I'm sitting here in my office at Galter Library, not working from home today. And I do have slides for you, which you got ahead of time, I think. But I will be breaking away from the slides to do some live demonstrations during the session. And at any time, I'm kind of working between two screens here. So at any time, if you want to ask a question, feel free to raise it in the chat, and I'll try to keep an eye on the chat and or raise your hand. Although I don't always see that quite as well because Zoom is on my smaller screen and I can barely see when a hand is raised.
No worries, I can refer questions to you. So I will keep an eye on that.
All right. So I'm going to launch right into this because this often takes quite a bit of time to discuss. So I'm going to share my screen. And go into presentation mode. So the NIH Public Access Policy, what should you know? I realized I didn't put my name on the first slide, so I went ahead and just did that today. So I have to move the Zoom bar around a little bit here. So this is the NIH Public Access Policy in a nutshell. Basically, it says that if you are NIH funded, all of your peer-reviewed manuscripts supported in whole or in part by NIH awards, and this has been in place since 2008, must be deposited to NIH's full-text database called PubMed Central. And when they get deposited to PubMed Central, they receive a PMC ID. Papers have to display this PMC ID 3 months after their publication date. And this is a tricky little thing because publications that go into PubMed, the PubMed database, not PubMed Central, get an EPUB ahead of print date. And that date actually serves as a cutoff date as well, in addition to later the official publication date. So within 3 months after any date at which they first appear, they must display a PMC ID. And then the full text itself doesn't need to be visible in PubMed Central until 12 months after the official publication date. And this is to satisfy the publishers who get their money from people paying for full content. And ultimately, it is up to investigators, not the journals, not the publishers, to make sure that their publications are compliant with the NIH Public Access Policy. So I'm going to go through attributing publications to your awards or to someone else's award if it funds you, the requirements of the policy and how to manage your publications within NCBI's My Bibliography. I'm going to at least show you a little bit of what things look like in depositing papers to NIHMS, but I don't want to spend too much time on that. I will make myself available to people if you ever need assistance to deposit to the NIH manuscript submission system, and I'll talk more about that in a little bit. So I'm not going to spend a lot of time on this slide. Basically, the nutshell slide was virtually identical to this slide, which is the NIH Public Access Policy itself, except I have a link to publicaccess.nih.gov, and I will show you that site in a little bit as well. And these are the legal terms of the policy, although it's a little bit longer in reality. But I have links available for you here so you can see them. Where it really becomes important is for progress reports. So progress reports are due every year for any funded awards from the NIH. And the NIH has started delaying funding for the following year's funds if publications that are attributed to whatever award is being reported upon do not have PMC IDs associated with them. And the law states that investigators need to use my NCBI's My Bibliography to manage their award to publication associations. And that's where the progress report, or as some people call it, the RIPR, RPPR, that's where it pulls its data from. So if you're funded by an NIH award, you really do have to use NCBI's My Bibliography system to manage awards that are covering or funding your work. Again, this only applies to full-length, peer-reviewed journal manuscripts. So you don't have to worry about it for book chapters, conference presentations, things like that, just for full-length, peer-reviewed journal manuscripts that are funded by the NIH. So many caveats. All right, I made a little relationship slide some time ago, just so that people can understand the associations between these systems at the NIH. So we have a clinical investigator or any kind of researcher really. She gets a big bag of money virtually in the form of her NIH awards or somebody else's NIH awards. She has to manage these awards through the ERA Commons system at the NIH. Then she publishes papers. Again, not physically anymore. They're all virtual for the most part. The full text of these manuscripts that she publishes must be deposited to the NIH's database called PubMed Central. It's a database of full text. Now, there are some journals that assist her in this process, and they're called PMC journals. PMC journals automatically deposit all of their contents directly into PubMed Central, and the investigator or the author has to do very little. But many of the journals, in fact, I'd say probably most of the journals that our investigators here at Northwestern publish in are not PMC journals that deposit all their content directly to PubMed Central. So most of our authors have to use the NIH manuscript submission system to deposit their papers to PubMed Central, kind of through this intermediary deposit system. And then at reporting time, or preferably before reporting time, well in advance of when progress reports are due, you use your ERA Commons link to associate your publications with your awards within the My NCBI My Bibliography system. So we've got the database PubMed Central, we've got the NIH manuscript submission system, we've got ERA Commons, which manages all the grant information, and that is all linked through NCBI's My Bibliography. Where people fall down on the job the most often is they don't know if they have to deposit their papers through NIHMS or not. They think it just happens. It's done by somebody else, or it just automatically happens as soon as they associate their awards to their publications. So this is where people tend to kind of lose their way and not get their job done when it comes to reporting. So I tell people, in order to make your life a little bit easier, if you're the author, when you choose your journal, look up your journal at the NIH Public Access site to see if it is a journal that submits directly to PubMed Central. Then you don't have to worry about anything. If it's not, then you know that you have to deposit the paper yourself or with assistance from somebody else that you delegate via NIHMS. When you sign your publisher's contract, read it and see if they have a section where you can indicate that you're NIH funded. And if they ask you for your grant numbers or the award numbers of your co-authors, provide them that information. Some publishers will actually assist you. Even if they don't deposit directly to PubMed Central, they will assist you in maybe depositing the final version of the manuscript to NIHMS for you so that you don't have to track it down and try to find where it was saved. And then the NIH says at or immediately after publication, but I tell people if your journal is one that is indexed in the literature search database PubMed, if your journal is one of those journals that's indexed by PubMed, as soon as your paper gets an entry in PubMed, If you do have to deposit your paper to PubMed Central via NIHMS, start the process as soon as it gets a record in PubMed so that you can actually get the ball rolling and get the full text in there, because the process takes time. The NIHMS staff actually has to convert your version of the paper to the final version that goes into PubMed Central. So actually, before I go on to FAQs, I am going to go ahead and go into the NIH Public Access Policy site. And so for just a second, I'm going to stop sharing. And I'm going to share another screen. All right. Here we go. So this is the NIH Public Access Policies homepage. It's publicaccess.nih.gov. So if you don't remember anything that I tell you today and you can't find the slides or something like that, you can always contact me, first of all. But if you want to look up any information about the NIH Public Access Policy, this is a good place to start. All the information that I get for my slides is from this site. So it's publicaccess.nih.gov. And one of the things that you can look up here is in this green, let me go back, in this green area under accepted for publication. This is where you go to look up to see if the journal that you want to publish in deposits directly to PubMed Central or not. The place where that is in this second row of boxes under Method A, the link that says Journals. So you can look up to see if the journal you want to publish in deposits everything directly to PubMed Central, so you don't have to worry about compliance yourself, except for reporting it. So I'm going to look up Nature in here. Let's say you're publishing in Nature, just Nature, not Nature Communications and not the Nature and Science of Sleep. So if you're typing your journal name in this and it doesn't show up on the list below in yellow, that means your journal does not deposit directly to PubMed Central. And you know that your paper has to get into PubMed Central via some other means, usually mediated by you or somebody that you delegate to assist you. Also on this site are a whole bunch of useful NIH Public Access Policy FAQs that I also have in my slides, some of them. So I do a lot of bouncing around. I'm going to stop sharing and share my slides again. So I'm going to ask you all, is there anyone here who does not know the difference between a PMCID and a PMID? Feel free to speak up. Or, oh, okay. Okay, yeah, it's fine. Don't ever be ashamed. I mean, people can do this, they can be research administrators for years and still forget, because you really only have to do this compliance related stuff, once, maybe twice a year. It depends on how many grants you manage. So people forget all the time. So don't feel any shame in that at all. And I deal with this stuff every day. So so the PMCID stands for PubMed Central Identifier, or ID. And it is only required, again, for manuscripts that are peer reviewed, full text journal articles that were supported in full or in part by NIH awards and accepted for publication on or after April 7th of 2008. This policy has been in place for a while. So basically anything that's NIH funded that is full text and peer reviewed has to be assigned a PMCID. I tell people, if you can't remember that PMC stands for PubMed Central, think of the C in the PMCID as compliance. That's the identifier that indicates that your paper is in compliance with the NIH law about full text being deposited to PubMed Central. The PMC is not the same as the PMID. So PMCID and PMID only differ by one letter. That really frustrates people. But the PubMed ID is the PMID. So if you've ever done a literature search in PubMed for background literature for a thesis or a paper or something like that, you're probably often using PubMed. And PubMed is just an index of abstracts and titles and authors and things like that, citation information basically, that then you can link to view full text. But every paper entered into PubMed gets a PMID. It's basically just an indexing identifier. Whereas PMCIDs are only required for full text journal articles that are funded by the NIH. So even papers that aren't indexed in PubMed may require a PubMed Central ID if they're published, say, in engineering journals that don't get indexed in PubMed, or social science journals. And not every paper that is viewable or searchable in PubMed will require a PMCID. So PMCIDs are usually required to be displayed in your grant applications and your bio sketches for anything, again, that was NIH funded and full text. And the place to put it is at the end of a citation. So I've just got an example of it right here. If a paper is not NIH funded, then it does not need a PMCID. You don't have to include it in the citation. You don't have to try to get it. I have some other identifiers in this particular citation, although a lot of people think that this format looks kind of ugly because the DOI, the digital object identifier, is so long. You're not required to include any other identifiers other than the PMCID, but only for NIH funded citations. And ultimately, it ends up falling upon the principal investigator for the award if publications linked to the award are not compliant at the time of reporting. So if you're an author supported by someone else's award, please make sure that you kind of help them by being aware of whether your paper needs to be deposited to PubMed Central, and whether you have to take part in the deposit of the paper. PIs and authors can actually assign compliance checking to other people. I do it for a lot of people, research administrators, program assistants. Lots of other individuals can be delegated authority to check on compliance by PIs or authors, just to assist them along. But at some point, there may be a point when the principal investigator or the author has to do something him or herself. So before I move on to how you build your My Bibliography, I'm going to ask if anybody has a question, any questions just kind of on the background of the NIH Public Access Policy.
One quick question that I have is, what is the sort of penalty that could be faced for failing to get a PMCID?
The penalty is that the next year's funding is withheld by the NIH. So if you're submitting a final year progress report, there's really very little penalty you'll suffer because there's no money left to be withheld. But it has happened very often at Northwestern and at other institutions where publications were submitted on a progress report and people didn't realize that they needed to have PMCIDs. They didn't know how to get them. And so if the PMCID isn't assigned to a paper before the money is due to be released for the next funding year, that money is withheld. And the NIH definitely does do that. And I get lots of panicked calls from investigators when they realize that that's going to happen. And honestly, you cannot speed up the process. If a paper hasn't been signed to PMCID and it needs to be processed by the NIH manuscript submission system, that process takes 4 to 6 weeks. And if you realize a week before your progress report is due that you need PMCIDs on some of your publications, it's not going to be enough. So your funding will either get delayed or withheld until those papers get PMCIDs associated with them.
Thank you.
Sure. So let's go into the nitty gritty of managing your awards that support your work with NCBI's My Bibliography. Again, this is the system that is required by the National Institutes of Health to be used for managing your manuscript to grant associations for reporting. And anyone can create a My Bibliography within My NCBI, even if they don't have NIH awards that support their work. So sometimes people just want to create a My Bibliography at NCBI so that they can keep it, a little a little track of their own publications and have a link to place on their NIH BioSketch. But if you need to manage award associations with your papers, then you also have to have an ERA Commons account that you link to your MyBibliography. So having said that, one of the easiest ways to get started in my NCBI is everybody, or almost everybody knows where PubMed is. So you can start from PubMed and log into NCBI from the PubMed website. So again, I'm going to, stop sharing and share again. I'm going to go back to Google Chrome. All right. So here's PubMed. Right up here in the upper right-hand corner, there's a link to log in. And you just click on that. Oh, I get a server error. Oh my goodness. I hope that that's not the case. Well, let's see. PubMed. Let's try Googling for PubMed. Oh my goodness. So I may not be able to demo here today. Yeah, it was working this morning. These things always happen. Oh, there we go. Okay, just tried reloading the page. So if you click on the login button to log in to NCBI from any NCBI page, and PubMed is the most common one, so I'm just using that. There are lots of ways you can log into NCBI. If you are managing your award to paper associations, the login you want to use is either ERA Commons here or login.gov. If you have an ERA Commons account. If you don't have an ERA Commons account, you can log in or create an NCBI account through a whole bunch of other platforms. Not only is there Google and Facebook, but if you click on more login options, you can even log in through your Northwestern login credentials to go into my NCBI and start making your MyBibliography. So my login is via ERA Commons, although I do sometimes log in via login.gov. So I'm going to sign in via Commons. Oops. I had to change my password last week, and sometimes I forget. All right. So now I'm logged in via Commons, and it says that I am Pamela Shaw at ERA Commons. So if I click on this particular my name link, I get a little menu that pops up that's basically a menu to the dashboard or directly to my bibliography, which is publications, or my account settings. So one of the things I'm going to show you first is, before we get into your MyBibliography, if you have an ERA Commons account and you have a MyNCBI account, but they aren't linked and you want to know how to link those two, the way you manage that is through your account settings from this little pop-up menu. So on your account settings page, you'll see the email that's associated with your account. And then underneath that a little bit are linked accounts. I already have Commons linked to my account. But if I didn't, I could just click on the change button. And oh my goodness, NCBI is slow today. A little search box will pop up where I can search for NIH. And here it is, NIH and ERA Commons. So anybody who's responsible for being covered by a grant will have an ERA Commons account. And a lot of research administrators and project managers also have ERA Commons accounts. So if you want to manage your own or anyone else's bibliography, you'll have to link your MyBibliography to your ERA Commons account. And I would simply click on that, go over to Commons, log in there. It'll take me back to my account settings page, and the two accounts will be linked. So I'm also going to go back to my account settings. And for any authors or investigators, also on this page, there is a delegate section. So if you want to have other people assist you with your My Bibliography, you can name them as delegates. You click on the Add a Delegate link and provide their email. They will get an email telling them that you have named them as a delegate for your My Bibliography, and they have about a day to reply and confirm that association. So then they can help you manage your bibliography. All right. So to get to My Bibliography, you'll notice that the links on these older NCBI pages up here look a little bit different from the one that was a spiffy pop-up menu from PubMed. These are older pages. They haven't updated these interfaces yet. It's going to take a while. So if I want to go into my NCBI dashboard, I just click on My NCBI, that link there. And My Bibliography is one of the panels within your NCBI dashboard. Now mine's taking a while to load because I have over 1,000 citations in my bibliography because I manage grant compliance through my own bibliography. But if you have nothing here, all you have to do is click on the Manage My Bibliography link, and that will take you into a bibliography page where you can start building it. Or if you already have one, like I do, clicking on Manage My Bibliography takes you into your established bibliography link. So publications don't get into your bibliography automatically. There's only one case in which they will just magically show up there, and that is if you are a PI of an award and someone else has linked your award to their paper. Their paper will magically appear in your My Bibliography. Otherwise, there won't be anything in your bibliography. People ask me all the time, well, can't you tell PubMed to send publications directly to your bibliography using, say, a name search? Unfortunately, no. PubMed is not very good at disambiguating very common names, like last names of Smith or Lee or Jones or something like that. So there's no way to kind of automatically send stuff into your own My Bibliography through an automated practice. So to get stuff into your bibliography, you can click on Add Citations. You can search for them from PubMed. You can upload a file, say an RAS file that you've exported from EndNote, although this process is a little bit buggy and somewhat incomplete. Or you can manually create entries for your My Bibliography. If you want to bring them in from PubMed, you just click on Add Citations and then from PubMed, and you can do a search in PubMed for your name and your affiliation, for example, or for the title words of one of the papers you want to add. I use as a demonstration my former boss. I used to work for Marcel Mejelim here at Northwestern, and I also added his affiliation when I did this search. And now it pops up for me because it's a search I've done in the past. Search PubMed. And then you just simply click check boxes and add those citations to your My Bibliography. So let's say you publish a paper that isn't indexed in PubMed. So this takes a moment to get added to my bibliography, then I need to close the PubMed search box. If you've published a paper that isn't indexed in PubMed, or let's say you want to put your conference abstracts in your My Bibliography so that you can have them all there in a nice place where you can create a link so the public can see it. In that case, you might want to add citations manually. Add citation manually. And the default is a journal article that does not appear in PubMed because that's the most common format. But you can also add book chapters or full books, software, preprints, conference abstracts, things like that. Just remember that any publication type except for journal article does not require a PMC ID. Other things can be peer reviewed. For example, book chapters or conference abstracts are often peer reviewed for conferences, but they are not full-length journal manuscripts, so they don't require PMC IDs. So you can create records for them in your My Bibliography if you want to have a nice listing of them that you can share a link with people for. But these other types of publications don't require PMC IDs. And this form will change depending on what type of publication you choose to add to your My Bibliography. All right, so I want to point out that I am logged into my bibliography through ERA Commons. Do you see this little ERA logo here? And if I were not logged in through ERA Commons, I wouldn't see these colored public access compliance boxes over here on the right-hand side. So this is when it's important that you link your ERA Commons account to your My NCBI bibliography account, because otherwise you won't be able to manage grant to paper associations. So I'm seeing these compliance colored boxes over here. I've got some green ones, some red ones. If I want to add my award or an award that supported me to any of these publications, I can either click on this link that has a certain number of awards. So that in this case, it was 2 awards. And then I have an old training grant myself from many years ago. My awards show up above this line. Other awards that are associated with the paper already show up below with locks next to them. Or I can search and add somebody else's award that supported me. So I like to use as an example, and you can search by either grant number or grantee, the PI's first and last name. And remember that for training awards, unless it's an F award, you will not be the PI of the award. So you'll have to know the PI of the award's name in order to search the award by PI first and last name. Not all of us can memorize grant numbers, but there are a couple I know. One is the New Cats Award because I manage compliance for this award every single year. So I typed in the award number and I see, oh, there's the New Cats Award. It's under Richard DeQuilla's name. And I can now click this checkbox and associate that award with this paper, which I won't do because this isn't my paper. It's not my award. And I don't want to do that in real life. But if I did, I would get a confirmation. And then after closing this box, this award link will update to read 3 awards. If there are no citations associated with the paper, you'll see that there's this button that says add award, as opposed to like 1 award or 2 awards or 12 awards. Basically, the same box pops up when you click on that. I can also add awards instead by clicking the edit status link for anything that hasn't yet been associated with an award. In that case, if it hasn't been associated with an award yet, I say yes, the NIH supported it. And then I have some options down here of saying begin submission in the NIHMS, or it's already in NIHMS, or in the cases of things like, let's say you do want to associate an award with a conference abstract or something like that. You just have to say that the citation does not need to be submitted under the NIH Public Access because it wasn't peer reviewed. Again, even though conference abstracts are peer reviewed, they're not peer-reviewed full-length manuscripts. So you can say, yes, the NIH supported this, but it doesn't need to be submitted under NIH PA because it's not peer-reviewed. I'm going to cancel this. So there are a whole bunch of different status colors that show up in your My Bibliography. Green means it's compliant and it already has a PMC ID. Red either means that a grant has been associated with it and it does not have a PMC ID, but there's a darker red color that shows that no awards have been associated and they don't have PMC IDs. So that's public access compliance status not defined. It turns a lighter color red and gets an exclamation point next to it when awards are associated, but it does not yet have a PMC ID associated with it. You can filter your bibliography by compliance status by going up to the top, and the compliance statuses are up here. Green with check mark means compliant, PMC ID exists. Blue with an arrow means that it's in process, either at NIHMS or it's a PMC journal in process, as I mentioned about those PMC journals earlier. Exclamation points and red are the non-compliant ones. And red question marks are the ones that have had no grants associated with them yet. They're just unassociated publications within your My Bibliography. So I'm going to click on the ones that are in process. There are some that are PMC journals in process, some that are in process at NIHMS, and the NIHMS ID shows up here. So I've been talking at you all for about 30 to 34 minutes so far. So this is kind of how to view citation, or sorry, view compliance information and manage your My Bibliography. Does anybody have any questions about kind of working around in this system? Everybody's asleep. No.
I have a question. So I'm curious about publications that come from non-NIH grant funded sources. Would you report those in My Bibliography, and how would that show up in this documentation?
That's a really common question, and thank you for asking that. Actually, you can't unless it's another Health and Human Services funding agency that happens to be partially managed by the NIH. This particular platform is only for, well, you can put publications into your bibliography that aren't funded by NIH awards, but the only awards that you can manage and associate with your publications are NIH awards or other HHS awards that might be searchable in the system. This particular platform of reporting awards to publications is only NIH awards, sadly. So you can't associate NSF awards within this platform. You can't associate American Heart Association awards within this platform unless they happen to fall under an HHS umbrella. So no, that's a really good question. All right. So these papers that I see are public access compliance in process at NIHMS. Just something to be aware of is if I look at the publication date, it's so far an EPUB ahead of print. This publication actually does have a publication date of 2021, May 25th. Theoretically, by 3 months after the publication date, so that would have been what, August 25th? This paper should have changed from blue and in process at NIHMS to red and non-compliant, even though it's still in process at NIHMS. That's what usually happens. But every once in a while, the NIH falls behind on turning things into non-compliant status. But I just want to warn people that even though you deposit a paper to the NIH manuscript submission system so that it can get a PMC ID, if it goes too far beyond 3 months after the official publication date on the manuscript, even though it's still in process, it'll become non-compliant until it finally gets that PMC ID. Okay, I'm going to clear my filters. So so let's say you've added your publications to your bibliography, you've associated your awards with your papers, and you notice you have some that are non-compliant or one that's non-compliant, and you need to deposit it to PubMed Central because you've looked it up at publicaccess.nih.gov, and it's not in that list of PMC journals. Darn it. So they won't do it all for you. You can start the process directly from your My Bibliography. If you click on Edit Status, you can start with Begin Submission in the NIHMS by clicking on that radio button and save, and it'll pop open a new window for you in your selected browser to start submitting to NIHMS. Gonna hit cancel on that. So I usually don't try to demonstrate this unless I have more than an hour's worth of time to talk about it, because the NIHMS system is a whole bunch of steps, and it kind of gets a little overwhelming, and you may never have to use the system. So I always tell people you can always contact me. My contact information is on the last slide, and I think you probably have my email address. But anyway, if you need assistance in depositing to the NIHMS, I'm going to stop sharing and go back to my slides, where I have a few kind of screenshots of what NIHMS kind of looks like. All right. So I'm going to zoom past all these. I kind of showed you all about adding stuff to your bibliography, the different statuses, how to link papers with your bibliography. I already mentioned that delegates can be assigned by PIs, and delegates, if they need to manage grants, need to have an ERA Commons account in addition to creating an account at my NCBI, which isn't too hard. You can even just log in through Commons and it'll kind of automatically on the fly create an account for you at my NCBI. So if you have publications that need to get PMC IDs and aren't in PMC journals in that list that you can look up in, you'll need to deposit them through the NIH manuscript submission system. That's what NIHMS is. The questions you ask yourself is, was the paper NIH funded? Yes. Is it not published in a PMC journal? No. Then you know it has to get into PubMed Central via NIHMS. That requires some action on behalf of the authors and or the PI or someone acting on their behalf. Again, if it gets too far past the 3-month post-publication date period, it'll be non-compliant with the NIH Public Access Policy and it can withhold funding. So the version that you should be depositing to NIHMS is the final author's version, but a lot of people can't find that, so they will upload the final publisher's version. It's a copyright infringement to do that, so I will not do that on behalf of someone else. But if you've got nothing else and you need to do it yourself, you can upload that version to the NIHMS. Basically, it's the same as logging into my NCBI. You log in, you can log in with the ERA Commons if you want, but just so you know, if you want to have an assistant help you by uploading your papers for you, they don't have to have Commons in order to log into NIHMS. They just have to have a way to log into my NCBI. So again, through your Northwestern account, through Commons if you have a Commons account, through a whole bunch of different accounts. Basically, what you do is the paper is uploaded. And I recommend, again, using the final author's version because it's the best quality of the figures and tables that you can get, rather than pulling an electronic copy from the publisher's site and then slapping it into NIHMS. The quality will be much worse. Then someone has to be named as the reviewer. The reviewer can be a PI of an associated award or one of the authors. So if I upload a paper for you, but I'm not an author on that paper, I can't also review it. I can upload it for you, but since I am not an author or a PI, I'm not allowed to be a reviewer because theoretically I wouldn't be able to identify any slight errors that might be in the text. After the reviewer approves that upload, NIHMS staff converts it. This takes 4 to 6 weeks. The reviewer gets a second email notification that the final version is available for them to review. So you have to review it twice if you're a reviewer. And it's the PMC ready version. Everything in PubMed Central looks the same. They're all formatted the same. They're mobile optimized. So once that version is ready, the reviewer gets a second notification. They log in again, they take a look at it, they approve it, and then finally it gets released for a PMC ID. So I tell people you can assign delegates to help you with this process, but if you are named as the reviewer in NIHMS for your paper or someone else's paper or something like that, please do not ignore emails from the NIHMS system. They kind of look like spam because they are plain computer text with big long links in them. But the subject line and the sender will also always have NIHMS somewhere in one of those lines. So please don't ignore those emails because that's how papers get stalled as well, as somebody's waiting for you to approve a paper that needs to be released so it can get a PMC ID and be compliant. So I have filled up almost all of 45 minutes with discussion on how to get through compliance with my NCBI and my bibliography. I had tacked on a couple of slides at the end for resources on tracking your impact. If any of you are affiliated with Northwestern University and you want to check out the Galter Library's website on impact, our metrics and impact core has a LibGuide that's really useful on tracking your impact. I like to just show people those resources because I'm not a member of the metrics and impact core, but young investigators are always interested in how to kind of track their publications as they're getting cited and all that good stuff. So I tacked on a couple of slides at the end of the presentation that you can use the links for and go into if you're curious about getting started in tracking your own impact, basically meaning citation metrics. So I just filled up all the time. Do we have the full hour so that we can have time for questions? Okay, excellent. So fire away, anyone, if you have any questions. I'm happy to stay as long as you need to answer them.
I guess I can go first, but one question that I did have is, throughout your presentation, you stressed that PMCIDs are only necessary for full-length journal articles. Can you kind of expand a little on what do you mean what do you mean when you say a full-length manuscript?
Yeah, that's phraseology that's used by the NIH, and these days it's gotten really hard to determine what is full length. So in fact, I've actually had to look this up a couple of times, even recently. There are publication types that are kind of new publication types, as in new within the last, say, decade or so. Things like brief communications, things like short reports. Turns out that even short reports and brief communications, if they are peer reviewed, are subject to the NIH Public Access Compliance Policy. So they do have to receive PMCIDs. And in addition to that, even if an article isn't original research, let me stop sharing. I don't need to do that right now unless somebody asks me to put my slides back up. Even if an article is not original research, in other words, if an award funds your time and you write a review or a systematic review, you should also obtain a PMCID for that review as well. So what it does not apply to is things like error corrections, or errata as they're called. It doesn't apply to most editorials because editorials are usually invited. It doesn't apply to most letters to the editor. So if you write a letter to the editor, you can still link your award to these types of publications, but they don't require PMCIDs. So it tends to be the short things that are either corrections or opinion pieces or something like that. Also, like I said, if you manually enter things like book chapters and stuff like that, you can link your award to things like book chapters, but they don't require PMCIDs because they are not journal articles. And interestingly enough, since they don't require PMCIDs, even if you link your award to them, when you are preparing the progress report at reporting time, you will indicate next to these publications in your My Bibliography that the NIH Public Access Policy does not apply to them, because say they're conference abstracts or they're letters to the editor or something like that. They don't end up getting automatically harvested into your progress report. So even though you've linked them to your award, since they are this other type and they have the status of not applicable, they don't get pulled into the progress report, unfortunately. So the place to cite other types of publications or scholarly output, as we like to call it, is usually within the text of the progress report itself. So say, in addition to the publications that are in section C of my progress report, this grant also supported, 15 conference abstracts, 4 book chapters, 2 software packages, et cetera, et cetera. And you can provide as much or as little detail about these other types of publications in the free text as you want to, or as you have room for within the progress report text.
Awesome. Thank you for that clarification. Does anyone else have any additional questions for Pamela?
I have another question. I was curious if you could just provide, what you would recommend in terms of from when you get that date of when it will be published, or, obviously there's a variety of dates that get, put out to, like, the whole process, what would you recommend in terms of managing, publications from, like, a good, like a grant stewardship perspective, just to ensure that you're compliant?
Yeah, I tell people that I have kind of a personal workflow that I do. It's not for my own work, but it's for other people's work. But I usually recommend to individuals, when you've submitted a publication to a publisher, it's going to be a while. After it's accepted, it's going to be a while until it shows up in a searchable database. So you can set notifications for yourself in searchable databases for your publications, or for someone else's publications, and as soon as one of your manuscripts kind of gets an entry into a searchable database, is when you probably, I tell people, is when you should start investigating whether you have to deposit to NIHMS or not. I tell people, I recommend against creating manual entries in your My Bibliography for journal articles that are published in journals that do get indexed by PubMed. So in other words, don't create a manual entry for something that eventually is going to have an official PubMed record that you can then search for and bring into your bibliography. The reason for this is that there may be two records for the same paper. And at grant reporting time, if you associate the award to the one that you created manually, but you don't associate the award to the one that's in PubMed, you may have an incomplete progress report. But so as soon as there's a record in a searchable database like PubMed for one of your papers, start investigating whether it's in a PMC journal or not. If it's not, then you have to start gathering the materials together to deposit to NIHMS. I tell people, if you can, once it has or an EPUB date ahead of print within PubMed, or it has some other date attached to it in another database like Scopus, is a good time to start gathering materials for upload to NIHMS. This is especially important if you are a principal investigator for a training award, which we're talking about right now, or if you're an author of a paper funded by a training award. Because what happens is individuals who are funded by training awards, they could be postdocs, they could be visiting scholars, they may leave and they may take the files with them. So it becomes really hard to track down the files associated with your award, especially for things like training awards. And so if you're the author, try to make sure that you have a final version of the file with the best quality figures that you've created for the file that's available for upload to NIHMS. Now, you don't have to do it yourself. Like I said, you can have somebody else help you with it, but it's usually a good idea for one of the authors to be named as a reviewer in NIHMS, because you're the only ones who are going to identify errors. I have heard of an instance by a trainee recently, within like the last 3 years, where after the NIHMS staff converted his tables, all his negative table values were suddenly positives. They were no longer negative numbers. And so obviously that had to be fixed. And it wasn't the original uploaded version. It was the final converted version that had been converted for PMC. So in between the author's version of the paper and the final version of the paper, errors were introduced. So whoever is named within NIHMS as being responsible for reviewing a manuscript really does have to take a good look at the materials that are uploaded and available. So I tell people also, my process is, since I track so many papers in my bibliography, when I had it open, you may have noticed that I have like 16 or 1700 citations in there. But most people aren't going to have that many. I manage compliance twice a week, but that's only because I track a whole bunch of people just at their request. If you are a program manager or research administrator for multiple grants, or even just one, you may want to set aside a half a day. Like Fridays are good days for compliance. I I don't know if they are or not. That's when I tend to get panicked calls from people because the progress report is due on Friday and they discover that something is non-compliant that same day. So I just have set aside Fridays for compliance. I tell people to do that, check weekly. Even if you don't think you have anything processing, you might want to keep reminders in your calendar for something that has been uploaded to NIHMS and it's like 4 weeks later and, oh, it's time to start checking to see if it's available for the reviewer to review the second time. So I don't know, as soon as it gets an entry in a searchable database, and then after you've uploaded NIHMS, put weekly reminders in your calendar to check on its progress. And if you are not the person who's the reviewer, but you're someone who's responsible for kind of keeping the reviewer on their toes, like me or a research administrator or somebody like that, you can send those weekly gentle emails to people saying, hey, you've got publications in NIHMS that need to be reviewed.
We have just a little under 5 minutes left. Does anyone else have any questions?
Nope. Like I said, I have stunned everybody into silence. Everybody's asleep. Anybody who's got their camera off is probably sleeping or doing something else right now. And I don't blame you. This stuff is not exciting. It's unfortunate. It's necessary. So if you are funded by an award, it's necessary that you kind of learn how the system works. But it's not interesting. I don't know. It's kind of boring. It's so many moving parts. So I do believe that I said that I was going to put my contact information up on the last slide, and then I didn't actually share the slide with you. So I will get that up here quickly. There we go. There I am. And actually, my days for being accessible at my mobile number have changed. I'm now in my office Monday, Tuesday, and Thursday. So the 312 number, and then I can be reachable at home via the 773 number only on Wednesdays and Fridays. Sorry, I totally forgot to update that part. Or by that email address.
Wait, can you repeat? So the 773 number, you're only accessible on Monday and Wednesdays?
The 773 number is my mobile number to reach me while I'm working from home. That's on Wednesdays and Fridays. So I'm sorry about that. Yeah, Monday, Tuesday, and Thursday, I'm in the office and I can be reached at the office phone. And then Wednesday and Friday, I can be reached by my mobile phone. I have a standing medical appointment on Wednesdays, so I may not always answer my mobile right away on those days, but I usually get back to people pretty quickly.
Thank you. I will be sure I've taken down the information. So the recording would be uploaded to YouTube and then sent to the link sent to attendees that couldn't or people that couldn't attend. And in that summary email, I will also be sharing the presentation that you sent me, unless you want to send me this most updated version, which will also be shared to the trainees. And then I'll also share your contact information for them as well. But thank you so much for presenting to us
very
today.
Good. Oh, of course. And I'm sorry, I did make a couple of changes at the very last minute. Like I said, I realized I didn't even put my name on the first slide, although it's not necessary because it's on the last slide. But I also think I changed one screenshot because the NIH did change a couple of login screens just a little bit. So yeah, I'll send you those slides right away as soon as we're done.
Awesome. Thank you so much. And thank you everyone for joining today and being engaged. I will be in touch with our October event as well. So enjoy the rest of your day.
Thanks everyone and good luck with your work.
Thank you.
Thank you.